Idaho has made some great strides in the last couple of weeks when it comes to the COVID vaccine. We've gone from one of the slowest at getting shots into arms to one of the top 5 fastest, according to the state's Department of Health and Welfare. Idaho has succeeded in giving out nearly 94% of the doses we have received within a week of getting them in the hands. We put them in the arms. Plus, we're about to get almost 10,000 doses more a week into our local pharmacies through the federal retail pharmacy program. Well, that's on top of the 25,000 we are already getting. And nearly 40% of those 65 and older across the state have gotten at least one dose of the vaccine. That's not to say there isn't frustration out there. We hear about it. Still, a bit of a logjam when it comes to signing up for a vaccine appointment, for example. And yesterday, we learned there is now a residency requirement for getting a vaccine in Idaho after finding out 4,800 of Idaho's doses went to people who don't live here. How does this happen? Well, according to the Department of Health and Welfare, before yesterday, people just needed to provide proof that they were in a priority group that was currently qualified to get the vaccine. And up to when we added the 65-plus crowd to the mix at the beginning of this month, most of the priority groups were employee-based. That would be healthcare workers, frontline essential workers, long-term care providers and such, which meant a lot of those shots were being done at work. And not all of those who work at those places, especially near the border, not all of them live in Idaho. There's also the part-time resident factor, those that may winter here but not really consider Idaho or be considered an Idaho resident. So basically before yesterday, there wasn't a residency requirement. Now there is. But don't expect that to just instantly open up some spots on the schedule. The vaccine, still a hot commodity, which is why we were intrigued by this text message Shannon sent us yesterday. She was walking with a friend, and Shannon said, when she was told she needed to be more aggressive in getting a COVID-19 shot. At 61, she's not currently in an eligible category, but she was told she could get on a call list for leftover vaccines. Is this true? Well, Shannon, at 61, unfortunately, even being aggressive isn't going to get you closer to a COVID shot. However, this leftover vaccine waiting list made us wonder if there was such a thing. First, a leftover vaccine. What is this? Well, as you may have heard, these vials that they are sending out, like with the Pfizer vaccine, they're supposed to have 5 doses in them. But some are finding out they have like 6 or 7 in them. With Moderna, sometimes it's like 10 or 12. So when they schedule based on what is expected to be 5 doses, well, that leaves a little extra sometimes. And sometimes people cancel their appointment. Those vials, once opened, have to be used within 6 hours. So what happens then? We reached out to several of the vaccine providers in the Treasure Valley to see how they have handled it so far. And here's what SaintAlphonse has told us. They recently moved all of their vaccinations to one location, the old Gordman's building, the Village at Meridian. Doing that, they say, allows them to be more precise in how many vials they open, enough to meet that day's scheduled appointments. That way, they aren't opening vials at all of their area hospitals or clinics, and they can keep track of how many come through the door and they can adjust accordingly. And they do not have a wait list for leftover doses. And what about St. Luke's? To avoid wasting their doses, they did set up a cancellation list to rapidly fill some of those same-day openings. And it would give someone a notice, sometimes as little as 30 minutes, that there was a shot available for them. They were kind of sorted according to the next tier or group in line to be vaccinated. So there was a chance you could sneak in. But we're told that list got so long and those extra doses so few, well, St. Luke's is no longer adding people to their list. Primary Health, they do keep a wait list of eligible vaccine recipients who are willing to be called last minute at any time on any day should a leftover dose become available. However, right now, that list is not open to the public. It's just for their employees. They said they worked with local health districts to come up with an internal process for putting people on that list. So, not open to the public. Lastly, Albertsons. And they do currently have a wait list at their pharmacies. Those patients have to be within the current phase of eligibility, and they must contact the local store to be added to it. So yes, these leftover doses, the wait lists, they are a thing, just not a real viable one outside of Albertsons. And being an aggressive patient may not help as much as just being a patient one.